see happen? In other words, given your personal experience with your daughter, what would you most like to see happen in the healthcare system?
Well, there's a lot of faulty systems right now, faulty processes that need to be fixed, that unless you go through the situation yourself, you don't know that a particular thing is broken. It's a very fluid situation right now with Stewart Healthcare. And you know, I advocated for it in 2022. I'll continue to advocate for it now. It's, like I said, a very fluid situation where we have the Massachusetts Nurses Association, which I'm a member of, is working very closely with, you know, politicians like, you know, Elizabeth Warren and Ed Markey. We're trying to figure out all different kinds of vehicles to make it so that, you know, our major hospitals and systems don't close down, leaving people without care, which our family has personally experienced with my daughter. And all of a sudden, there's no doctor. The doors are closed. You don't know where they went. You know, it's a different world we live in right now, right? So, what I would like to say, to your point, is I think we need more politicians on Beacon Hill who have the political will to do the hard thing and fight for the hard topics like healthcare. And you know, a lot of times we don't want to lose votes. We don't want to lose our political base. So, but we have to do the hard things and we have to follow our conscience. So.
And you actually went to get your nursing degree because of your daughter's situation, right?
Yes, I did.
I have to say, I thought that was very moving.
Oh, thank you. So I became a CNA first. I still had my business. Then I became an LPN, and then I became an RN, and then I rose up the ranks to be, you know, a director of nursing. And you know what I learned as in administration, and I kind of liken it to maybe some things on Beacon Hill sometimes, is that when you're in administration, what you're doing 90% of the time is protecting. You're doing damage control rather than going forward and creating a good system where the patients will benefit. You're doing damage control. Oh, okay, the state's coming. They're going to audit my place. Let's run around like a nut and make sure, you know, it's kind of like that.
I mentioned this before, but my own personal experience. I had twin sons who had RSV at age 6 months old, and neither were expected to make it, and they're literally getting ready to have the chaplain follow us around and so forth. And it's extraordinarily scary as a parent to go through this, and at the end of the day, you have to end up being sort of your own quarterback on things, right, to figure out what the right decisions are.
Right.
Going forward. And it was extraordinarily frightening, and this is coming from the perspective of somebody who had the benefit of being educated and all the rest of that. And so thank you for doing what you're doing.
Thank you. Anyone else?
Could you give us a quick overview of how you think the State House, Beacon Hill, is, you know, responding to this healthcare issue? I listened to the Speaker of the House the other day on television, and he seemed really committed. Because they asked him if he was thinking of retiring anytime soon, and he's old school, you know. And he said no, because he said he feels he has to finish the job, and he's.
I read the same thing you did.
Okay, and he's in the position. He's been in the, you know, Beacon Hill for many years.
I think he's being sincere.
I do. Good, because I had that same impression.
I feel he's being sincere. Is he equipped to handle it all? Probably not. I think it's a teamwork. You know, it has to be a lot of factions coming together. And I think that we're at this breaking point where my feel is that people understand just how much of a crisis it is. Yeah.
And it's on the federal level, too. Because
well,
Stewart's not responding, they're not showing up, they're not giving us all their, you know, records, and they don't have to. There's no federal law.
Okay, so to your point, I'm so glad that you brought this up, is our laws are weak. Our laws are weak. We don't have the legal infrastructure. You're a lawyer. We don't have the legal infrastructure to even deal with the profiteers.